Hello, I'm Marina Makri from Thessaloniki, um, and I am a biologist and psychotherapist, and I am a PhD candidate in School of Medicine of Varaždin University of Thessaloniki in Greece, and I will present you an innovative course, an innovative project which focuses on the neurodegenerative genetic counseling, and this course will be developed by some European universities. This project called GENETIČKOM, and the main title of this project is Genetic Counseling in European Universities, the Case of Neurodegenerative Diseases. And the main goal of this project is to prepare and to develop an innovative course focusing on the genetic counseling of neurodegenerative disorders. It is an Erasmus Plus project in cooperation partnerships in higher education, and it lasts for 30 months. We are working on this project for the last year, and we will finish our project, and we will finish with all our results until the end of July 2024. We are the coordinator of this project as Varaždin University of Thessaloniki, and we also have included 5 different partners from other countries, like the University of Heidelberg in Germany, the VUB University of Brussels, the Smyrk Economy University, another institution from Barcelona, and also one more organization from Greece called Pan-Hellenic Institute of Neurodegenerative Disorders. Why did we apply for this project? It's very important to highlight why we did apply for this project. What's the need of society? As we know, genetic tests have gained importance in personalized medicine and disease prevention, and especially to healthy individuals who have a family history of disease or patients who may have a disease resulting from a genetic mutation. Also, as we know, according to the literature and some research results, at-risk relatives of 30 million Europeans affected by genetic conditions may be neither recognized nor managed appropriately due to the lack of knowledge about genetics and the few trained healthcare professionals. This contravenes the European Union aims and European Society of Human Genetics goals to create a safe, efficient, patient-centered, and sustainable healthcare system. What's the needs of people, of the general public? Individuals understanding about what genetic tests can achieve, what they cannot achieve, and the risk they pose should be more realistic. Genetic tests can increase risk for psychological harm, may elicit grief, distress, conflict, sadness, relief, guilt, uncertainty, and ambivalence. And that depends on the way that healthcare professionals disclose the genetic information. So it's very important to highlight that when well-informative and supported genetic counseling sessions take place, the genetic information can work as a predictive measure. For example, this information can create behavioral changes daily life changes, for example, to change their diet or to start to include more exercises in their daily life. And this information can also enhance decision making, which is very important in these diseases. Also, what's the needs of the healthcare professionals? According to some research, the profession of genetic counselor is established or developing in few European countries. There is a lack of genetic counselors and genetic counseling programs in Europe, and most genetic counselors trained in other countries, mainly in USA. There is also lack of training programs on genetic counseling on neurodegenerative disorders. Also, there are few healthcare professionals, and mainly these healthcare professionals are prepared to address the genetic counseling risks, but they don't know how to manage the psychological impact of the disclosure to relatives. In these slides, you can take a look on a map in which we can understand better the number of the genetic counselors in different places, and we can see that there are few 1,000 genetic counselors in Europe. Also, according to Abakan et al. In 2018, according to their publications, there are a lot of genetic counselors in England. However, there are a few genetic counselors in all the other countries, in Greece, and that depends on the training programs, because there are a few training programs in Europe. Before starting sharing with you more details about this innovative project, I would like to emphasize what is genetic counseling and to share with you the main definition according to the National Society of Genetic Counselors in 2006. Genetic counseling gives information about how genetic conditions might affect a person or a family. The genetic counselor or another healthcare professionals will collect personal history and family health history in this session. They can use this information to determine how likely it is that a person or a family member has a genetic condition. Also, based on this information, the genetic counselor can help the person or the family to decide whether a genetic test might be right for him, her, or a relative. What are the main goals of our project? With the GENETIČKOM project, we will try to address the following priorities. We'll try to build an inclusive higher education system with our course. We'll try to stimulate innovative learning and teaching practices. We will focus on the physical and mental health and well-being of the general public and people with inherited disorders. And we will try to create new learning and teaching methods and approaches. And finally, of course, to focus more on research and innovation. These are the main target groups of our project. We will include students and healthcare professionals, and these groups will be the main groups of this project, as we will create a course that will focus on their needs. We will also include professors of higher education institutions and families with inherited disorders. What do we want? What do we want to achieve by implementing this project? So, what's our main goals? We are trying to develop the best genetic counselor protocol, combine different protocols from different countries, and we'll try finally to prepare a methodological guide. A handbook will include guidelines about how to implement these sessions of genetic counseling for people with neurodegenerative disorders. Also, as I said, we will create an innovative European course on genetic counseling, which will be available on a service system. And this system can be easily integrated to other platforms. We will also try to promote the use of telegenetics as part of a remote genetic counseling services. Additionally, students will gain new competencies and knowledge and bring new skills into practice related to communication, empathy, and support. Also, we'll try to support families because we will try to combine knowledge enhancement and more person-centered process with the establishment of genetic knowledge and decision-making, and the psychological support. And finally, we'll try to enhance interconnected medicine and establish a multidisciplinary approach by the contribution of critical mass of experts and healthcare professionals. How will we achieve our goals? In this project, we have included 7 different work packages, and we are working in the main 4 work packages, the work package 2, 3, 4, and 5. The other 3, it's about the project management issues and the evaluation and monitoring of the project and the dissemination exploitation activities. So the main project consists of 4 different work packages, or we can call them project results. These project results consist of many different tasks, and you can take a look on this slide which describes these tasks. I will share with you a few details about our main steps in order to prepare this course. In the first step, in the first project result, we have developed a genetic counseling intervention methodology, as I said before, a methodology which includes guidelines. And in order to prepare these guidelines, we followed 3 different steps. We prepare genetic counseling intervention, we prepare we focus on the needs of the participants, and we finally develop those national implementation guidelines. In these steps, we gather regulations, national recommendation, and practices concerning genetic counseling in the context of genetic testing of participating countries in this project. And we also try to estimate how well genetic counseling is organized in each country and find out how the existence of or lack of such legislation and guidelines affect the practical of genetic counseling work. So we gather different guidelines, recommendations, and protocols from the participating countries in this project. Also, we collect the existing genetic counseling protocols of the participating countries, and we adapt these protocols according to our goals. We also focus on need analysis of the experts in the field, and we organize different focus groups in each country, which is the qualitative research of our project. In these focus groups, we try to collect some data about the best of the counseling course and the qualifications that needs a genetic counselor. We also focused on the general public needs, and we share with families of people with neurodegenerative disorder a questionnaire in order to collect their expectation, their attitudes about genetic testing and genetic counseling. And now we are in the last preparation of our results, and we will have the final report of these results in the next month. According to the general results of these recommendations, which is the first step of these project results, there are limited guidance documents on how to approach the counseling aspect of genetics. There are few documents that really describe how to conduct genetic counseling, originates from other countries and includes detailed flowcharts. Only Spain has a specific protocol for genetic counseling of dementia, and in participated university hospitals and research centers, there is also no local guideline for genetic counseling for neurodegenerative disorders. In our second project result, we will focus on the design, the development of this course, and the main material of our project. We will use the previous results, and we also have finished with a systematic research of the existing innovative materials and courses across Europe, and we also focused on the existing courses of the participating countries. Now we are in the second step, in which we try to develop the course, and we have also completed the third step, in which we prepared co-design sessions with different stakeholders, and we asked some experts to revise and to share comments about our course and the main structure and the content of our course. Finally, in the last step, we will translate all the materials in the course in different languages of the participating countries in this project. What's the main characteristics of this course? It will be an introduction to genetic counseling course in the field of neurodegenerative disorders, and it will mainly focus will mainly be a course for students of departments of psychology and sociology, and it could also be a course for other professionals in the field of health science that are interested to learn more about genetic counseling. The total duration of this course will be about 6 weeks. And in this table, I have summarized the main lessons and the units of this course. So in the first lesson, we'll have a welcome lesson to this course, and the first unit will include a description of the project, and the second unit will be an introduction to the online courses. In the second lesson, we will focus more on theory, and we will share more scientific information. So in the first unit, we will include basic inherited methods and theories. And the second unit, we will focus on the neurodegenerative inherited diseases, and we will also include ethical aspects of genetic counseling. In the third lesson, we will focus on the genetic counseling and practice, and we have the first unit, which is the main counseling approaches, the second unit, which will have details about how to cultivate counseling communication skills. In the fourth unit, in the fourth lesson, we will include information on how to implement genetic counseling sessions. And this lesson consists of 3 different units: the genetic counseling session, an overview, genetic counseling session in practice, and the use of telegenetics. Finally, the last lesson will be an evaluation questionnaire, and there will we will include some questions, and students and participants can share their feedback. Also, we will work parallel with the preparation of the course in the third project result, and the design development of the service system. In this project result, we'll try to develop this system and integrate this system to the different platforms. So this project result will develop the main platform, the main system, which will include our course. This e-course and this service system the preparation of this course and the service system consists of 4 different steps. In the first steps, we have collected and analyzed the stakeholder requirements. We have served a questionnaire with professors, teachers, and students in order to get their expectation and their needs. In the second step, we are working on the development of the service system. This system will include teaching material and make it possible for students to exchange information, ideas, and content, plan their own activities, and report on their results and experiences. It will take into account the student's scores during the evaluation assessment. I will propose educational material to students based on their level and scores. And it will also include telegenetic services like live video consultation. In the third step, we will insert this service system to the e-learning platforms of the medical departments of our project. And we will have a pilot which will run in the 4 different universities of this project in order to confirm that this system satisfies the requirements defined in the first step, and that this system meets the end user's expectation. How this system will work. When a user has studied all the course with MOOC, we call massive online open courses. When a user has studied all the course, a virtual system will be activated. The user will be able to interact with the virtual assistant in order to test their knowledge levels in the domain of the course. More specifically, the virtual assistant will engage the user in the interactive quiz, aiming to evaluate the student's performance and assign a score for each MOOC unit. Based on the learner's performance, the system will provide feedback to the learner and recommend the user to revise specific educational material offered in the course. Moreover, given the anonymous nature of the user bot interactives, the virtual assistant will address the user with some additional self-reflective questions. For example, asking how much time they have developed to complete the MOOC. Given that all the above data will be collected anonymously, the system will store all user-related information in an online spreadsheet, such as a Google Sheet. The latter will allow instructors and researchers to assess a series of valuable indicators and metrics. For instance, it will display some statistics relating to the average time the student spends on this course and showcase learners' pain points. Finally, the last project result of this project will include 20 counseling in practice, and we will organize 4 different pilots in the 4 different universities of our project. And in this pilot, students will have the chance to run our course and to evaluate our course. And after their evaluation, we will prepare a final guideline handbook on how to implement this course. So, in this pilot, as I said before, we will run the course in 4 different higher education institutions of this project for a duration of approximately 3 months. Its round will include at least 5 students and 10 relatives of people with neurodegenerative disorders. The teachers who will implement this pilot will be those who will have will taken part in an educational workshop. Collaboration with different local genetic diagnosis laboratories and institution or university hospital settings is very important for the implementation of this pilot. And also students will use our material and service system in order to prepare sessions with relatives. I would like also to share with you the main platforms of this project. You can follow our project and our news in our Facebook page, Twitter page, or LinkedIn page. Thank you for your attention.